Hello, welcome to this week's episode of NDTV. My name is Corinne Brown, naturopathic doctor, labor doula, mother, and host of this episode, where today we are chatting all about booby 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 boobies. As you can tell from my intro, today we are going to be talking about breasts in a fun, lovingly lighthearted manner. I do not intend to offend anyone, of course. My goal today is really to educate around the importance of proper breast care and to remove any stigma or self-consciousness associated with this fascinating area of our bodies. Because ladies, we all got them. Some are big, some are small, some are really small, but they're all beautiful and they deserve to be treated like queens. Breasts are actually quite fascinating and complex. They consist of fibrous tissue and fatty tissue, plus dense glandular tissue, which just means that it communicates with and responds to hormone messengers. That includes milk-producing glands called lobules and ducts to carry milk from the lobule to the nipple for breastfeeding. Because breasts are mainly fatty tissue, and we know that fat tissue likes to store toxins, it's very important that we make sure that no toxins are just sitting around in our breast tissue. Because breasts can be a bit of a toxin trap, there are lots and lots of breast pathologies that can crop up. And of course, breast cancer is the main breast pathology, and that is killing women across the world. If you're a human being living on planet Earth, you have seen the pink ribbon plastered across nearly every product in the grocery store. However, the Breast Cancer Society directs very little of its funds towards researching and promoting breast cancer prevention. So ladies, the onus lies on us. No matter the illness or disease, we must know our bodies. We must protect our bodies and we must care for our bodies in order to prevent the illnesses that we know are lurking behind the bushes. Screening options for breast pathologies include self-breast exam, practitioner-performed breast exam, mammogram, ultrasound, and breast thermography. So let's touch on each one right now. Sadly, the American Cancer Society has actually declared self-breast exams to be optional, citing a lack of evidence that they reduce breast cancer deaths. Well, I 100,000% disagree with this statement. Any organization whose goal it is to reduce cancer rates should every single time without fail encourage patients to evaluate their own bodies and be familiar with their bodies first and foremost. If the American Cancer Society is not seeing any clinical relevance to self-breast exams, it's probably because women are never properly taught to effectively do the exam. A woman performing a proper, regular self-breast exam will undoubtedly be more familiar with her own healthy baseline than a physician who assesses her only once per year. The ideal time to check your breasts is between 5 and 10 days after your menstrual cycle, or if you are in menopause, say at the beginning or middle or end of the month, just make sure it's consistent. Now, to begin the exam, you're going to do a sequence of movements in the mirror. Maybe throw on some tunes to make it a little bit more fun and high energy. While standing topless in the mirror, give yourself a little wink and the double guns and tell yourself you are beautiful just as you are. Stand normally. Now put your hands on your hips. Now squeeze your hands on your hips to flex those pectoral muscles. Now bend over and let the ladies dangle and raise your arms slowly out and up over your head, watching your breasts all the while. What you're looking for is any new changes, such as a distinct lump in or near your breast or underarm, a thick or firm tissue in or near your breast or underarm, any nipple discharge or tenderness, a nipple pulled back or inverted into the breast, itching or redness, scaling, dimpling, or puckering, and a change in breast size or shape. Now that the preliminary steps of the breast exam are complete, you can move on to the actual manual examination. Ideally, you are laying down flat, especially if you are more well endowed, as it spreads the breast tissue out over the rib cage, and so it's easier to palpate and feel what's going on in there. Another good option is in the mirror after your little dance sequence, or in the shower because the ladies are already bare and there. And every time you're doing a breast exam, you're going to want to do it with the relevant arm up over your head. To help me demonstrate the proper way to do a breast exam, let me introduce the boob ball. The breast exam must be done with the flat, firm pads of your fingers. No fingertips and no palm. The flat part of the finger is best because it covers the largest area, and if you find a lump, you can examine it with the fingers for its borders, its mobility, its firmness, and its tenderness. Now, it's best to have a predetermined route when doing a breast exam. Randomly feeling around the breast for any lesions or abnormalities doesn't ensure that every single square inch of the breast has been assessed. So there are 3 mapping techniques that we learned in school, and I'm going to teach them to you now. So the first breast exam technique is the concentric technique. So you're just going to go in concentric circles around the breast. First and foremost, with every type of breast exam that we're going to do here, we're going to assess the nipple. So you just want to gently squeeze around the nipple to make sure that there is no discharge. If you are a breastfeeding mom or have breastfed in the last 6 to 12 months even, there could be some residual milk coming. But if you have never breastfed or it's been years since you breastfed and there's discharge coming out, you'll want to get that assessed. So for the concentric exam, again, we're going to use the flat part of our fingers, and we're just going to go around the nipple. And ideally, like we said, the breast is flat and spread out along the rib cage. And then you're just going to keep going around. The second technique is the lawnmower technique. Which sounds kind of funny, but it's basically just like you would mow a lawn. So you're going to, for every breast exam as well, you're going to want to go all the way up into the armpit, because there can be lymph nodes that are inflamed in that area as well, and if you find those, you'll want to get those checked as well, because they can be the origin of the breast cancer. So with the lawnmower, you're going to actually start here in the armpit, the highest point, or you can start right to one side or the other of the sternum. So say I'm assessing my left breast here, I would begin at the top left-hand side of my sternum, where my sternum and my collarbone meet, and I would go down. So for the lawnmower technique, you're going down just like you would mow a lawn, all the way to the bottom of the breast tissue, over, all the way back up. And if you mow a lawn and you miss a big strip in the middle, that's no good. So you'll want to make sure that your path is nice and close to each other and you're not missing any point. And then you get to the nipple, assess the nipple, and move along. Okay, the final technique is the radial technique, which, just like all of the others, is going to assess the entire area of breast tissue. But the mapping technique you're going to use this time, you're going to start at the nipple and you're going to go out radially from the nipple. Provided you are having regular annual complete physical exams from your healthcare practitioner, a breast exam should be included in that. If, however, at any time you find anything suspicious on your own breast exams, make sure you bring that up with your practitioner as soon as possible. It is recommended that women start receiving mammograms between 40 and 50 years of age, depending on where you live, and every 2 years thereafter. If you have a strong family history of breast cancer, they will introduce this test earlier. Mammograms have been shown to reduce the risk of dying of breast cancer in women of 50 years of age and older by 35%. However, like any test, they are imperfect and they can miss a cancerous lesion, or they can falsely identify a benign lesion as cancerous. Mammograms also come with a risk of increased radiation. So if you're getting mammograms regularly over a long period of time, the risk of breast cancer does go up. However, over the age of 50, the benefits seem to outweigh the risks. Ultrasound is a non-invasive, radiation-free procedure that your doctor may offer before a mammogram if something suspicious was picked up on a physical exam. Lastly, thermography measures the distribution of heat among the breast tissue and is actually a very beautiful picture. I'm looking forward to getting one done. I might hang it up in my living room. Cancerous lesions will often be more metabolically active, so they will show up as an area of heat on the image that will be further explored with different imaging techniques. Thermography does not replace a mammogram, but it is a fantastic non-invasive way to determine if a mammogram and its inherent risks are warranted. Now, in between breast exams and your routine imaging procedures, let's chat about some things that you can do at home to keep your breasts safe. 1, keep an eye on them. Between regular self-breast exams, your physician exam, and just checking yourself out in the mirror on a daily basis, you'll get a really good idea for your healthy baseline normal breast tissue. 2, breastfeed. Not only is breastfeeding amazingly beneficial for your baby, but the permanent changes that take place in a breast after it has breastfed are protective for your long-term breast health. 3, avoid caffeine as it has methylxanthines that can contribute to fibrocystic breast tissue. 4, eat cruciferous veggies. They'll help to metabolize the excess sex hormones like estrogen and progesterone that can build up and hang out in your breast tissue and potentially stimulate estrogen-dependent cancers. 5, don't smoke. Besides the inherent cancer risks that come with smoking, the cigarette smoke damages the elastin in all of your tissues, including your breast tissue, making for some sad, saggy ladies. 6, your vitamin D status. It is estimated that 350,000 cases of breast cancer could be prevented worldwide by increasing vitamin D intake. 7, fish oils. Omega-3 fatty acids have been associated with protecting breast health. As one article explained, women with the highest amount of omega-3 fatty acids in their bodies have a 500% lower incidence of metastasis compared to women with the lowest levels of omega-3s. 8, avoid chemicals. Research on breast cancer tumors has found a higher concentration of certain chemicals such as parabens. Now, parabens are a preservative that are used in many products on the market today. And aside from their affinity to hang out in breast cancer cells, they also mimic estrogenic activity, which can actually stimulate cancer in women who are predisposed to estrogen-dependent cancers. 9, consider a healthy deodorant. Many women shave their armpits and create tiny little micro cuts which give a direct route to the bloodstream and very sensitive, vulnerable breast tissue. Then they'll go and apply their deodorant, which contains aluminum. Now, aluminum has been found to be in higher concentrations in the lymph nodes, the axillary lymph nodes of women with breast cancer. 10, avoid exogenous hormones. This means avoiding hormones that are not made by your own body. Oral contraceptive pills and hormone replacement therapy are associated with a higher risk of breast cancer. Wear a nice protective bra while you're doing high impact exercise, but it is very important to give your boobs some bra-free time. Over 85% of the lymph fluid drains from the breast into the axillary lymph nodes. The rest will drain along the collarbone and along the breastbone, but bras and other tight clothing can actually impede this flow. Women with very large breasts will even wear their bras to bed, but the larger the breast tissue, the more help their lymphatic system will need to drain those toxins. Women who wore their bras 24 hours a day had a 3 out of 4 chance of developing breast cancer. And women who rarely or never wore a bra had a 1 out of 168 chance of developing breast cancer. This clearly demonstrates the importance of letting those ladies hang loose and allowing adequate flow to and from the breast tissue. Everyone loves boobs, but most especially those sneaky, dangerous, fat-loving toxins. So that's it. I hope you learned something about breast care today, and if you have boobs or know someone with boobs, and you want them to be around for a long, long time, please don't be shy. Like, comment, share, and spread the naturopathic love and pass this video along. Breast cancer is a major cause of death among us ladies, so we must do our boob diligence and make sure we're doing our regular self-breast exams and getting regular checkups. Because remember, if mama's boobies ain't healthy, ain't nobody healthy. Thank you again so much for watching. It's been a pleasure. We'll see you next time on NDTV.